Welcome to another episode of Just for the Health of It. This morning we have Elizabeth Kaufman. She is the medical director at the Camden Family Health Clinic, and I'm Dr. Anita Stewart. I'm the health officer at the Nicholas County Health Department, and today we're going to be talking about respiratory season. So as the leaves are changing, we're getting into fall, and we're also getting into respiratory season. So Elizabeth and I are going to just chat a little bit about why it's important to be protected. So
thanks for having me. Good morning.
Yeah, you're welcome.
This is going to be fun.
Tell me, why do we worry about respiratory season? What's coming?
Well, that's a good question because I think a lot of the public, they ask the same thing and they need a little bit better understanding. It's important that we prepare for it because respiratory illnesses can be devastating, and it's important to try to safeguard yourself and your families from illness, long-term effects of those illnesses, and even death in some situations.
Yeah, and what kind of things are we talking about with respiratory season? Like what viruses or diseases that we're talking about?
So, flu. We're really, starting to get into flu season right now. COVID, RSV. Those are your top respiratory illnesses that we're going to encounter.
And when we're thinking about these things, who should be most concerned? Like who are our highest risk groups that we're talking about here?
Pregnant women, the elderly, and children are going to be our highest risk groups. And when I say elderly, primarily it's usually like 75 and up, but sometimes people, in 60 to 75 age group, depending upon other health conditions, they can be at really high risk as well.
Yeah. We're right here in the central part of West Virginia in the Mountain State. Have we seen any activity yet? Are you seeing anything in your patients so far?
We've seen quite a bit of COVID recently. And flu is just now starting to start up. Just a couple cases so far.
Yeah. So with things kind of starting to ramp up, and we've had a little bit of a summer wave this summer with COVID that seems to be coming down. What can we do to keep ourselves safe as a community and as individually as families?
So respiratory hygiene, of course, if you get sick, you want to cover your coughs and sneezes, good hand washing, don't share food or drinks. And of course, if you have the flu or COVID, stay home. Don't be out in public, don't be in large crowds, stay home from work and school. The new guidelines from the CDC say to stay home for about 24 hours, that you've not had a fever without fever-reducing medicine, and symptoms are improving.
Yeah, so let's talk about that just for a second, because that is a huge shift.
Big change.
When COVID first came out, and when we were really hot and heavy into COVID, we weren't really sure what was going on. We didn't have any treatments. We didn't have any testing really for this. We didn't know how to protect ourselves. We were still wiping off groceries, all those things. It seems like a long time ago, but it really wasn't that long ago. So why are things different now? Like, why have we shortened it?
Because we have treatment available now. We know a little bit more about it, so that's why. And the treatment medications, there's antiviral medication. Those medications can be prescribed by your doctor. They're most effective if they're started within 48 hours of symptom onset. But that's why, we've tried to shift and transition because, we know more. And also we have to try to transition back into some normalcy, get the kids in school and get people back to work.
Yeah. What about vaccines? I know that was one of the strategies that we have implemented. Tell me about how vaccines can help with respiratory season.
Oh, yeah. Of course, vaccines have been a huge part of that. So vaccines can help prevent illness, but they can also help prevent the severity of the symptoms and duration. Vaccines that are available for respiratory season, you've got your annual flu vaccine, which every patient 6 months and older should receive that. Your COVID vaccine, RSV vaccines. RSV should be given for adults 75 and older. Again, some adults age 60 to 75, depending upon other health conditions. Pregnant women, so that they can give immunity to their newborns. And then newborns, the kids up until about 19 months old should receive that as well. And then you've got pneumococcal vaccines as well that are available.
Yeah, so it seems like we have a lot of tools now in our toolbox that we just really didn't have a few years ago. And then certainly those medications and vaccines available for RSV, and certainly we still have those for flu. And What about for high-dose flu? Sometimes there's some confusion about like, should I get the high-dose flu? Should I not? Who should think about high-dose flu?
Again, those populations that are at higher risk for severe illness or hospitalization really should get the higher dose.
Great. So if somebody was interested in getting, a flu or COVID or RSV vaccine, when should they do that? Should we do that now? Should we be waiting? Or
now, respiratory illness season starts now. So September, October, ideally, is the best time to get the flu vaccine. COVID vaccine and RSV, you can pretty much get it any time, but right now would be the best time for those.
That's great. And do you guys have those available here at Camden Family Health, or are there other pharmacies in the community that have those vaccines available?
Yeah, we have the flu vaccine. We have pneumococcal vaccines. If we need someone vaccinated for COVID, we do have those sometimes, but we often send them to the health department or to the local pharmacy. And RSV, that one's been a little tough to get a hold of just because there's been a shortage of it. So currently we do not have it.
One thing that I know that we can do is folks can look at vaccine.gov. We know that there's lots of sites that have those vaccines there, and then our local pharmacies typically have those as well as, of course, we have them at the health department too. Yes, what if somebody's recently had COVID? What are you telling patients to do if they've had COVID recently? Should they be vaccinated now? Should they wait?
Well, the general rule of thumb is to wait about 60 to 90 days before getting vaccinated after having COVID.
Yeah. One thing that we do know is that vaccines have reduced high-risk disease, so getting hospitalized and certainly death related to COVID. Is that true also for flu?
Yes, it is. I read yesterday that the CDC is predicting that the flu vaccine this year for adults is probably, they're hoping the prediction is going to be about 40 to 45% reduction in hospitalizations related to the flu. For children, that percentage is a little bit higher. It's more like 50 to 60% reduction.
That's great. Last year, I know that Nicholas County in particular, our vaccination rate for influenza was about 28%. It's typically, our seniors typically do well, which are our highest risk groups, but we certainly see things kind of dwindle off as the ages get younger. So certainly, does it make sense, even though, say, like, I'm a healthy gal, should I get those vaccines? Like, what would you tell me if I was your patient?
I would tell you yes, even if you're healthy, you should still do that because protecting yourself also helps protect others. So by you getting vaccinated, that's going to help protect children and those older adults that might be at high risk.
Great. So if I come see you in the office, do I have to come like separate times? Should I space those vaccines out? Can I get them all at the same time? Like, what do you recommend?
You can get the flu and the COVID vaccine at the same time, which is really convenient for patients. So that would be fine.
Okay, great. And what about like side effects? Is there anything different that I should be worried about, or anything that?
Your side effects are going to be pretty typical of what you generally hear. So you might have some body aches, headache, maybe a low-grade temp. But that's pretty much symptoms that could be managed with some Tylenol or ibuprofen over the counter.
And when I get those vaccines, how long would you say that it would take for me to get protected? Like, what if I have we know holidays are just around the corner, and like I always go to my grandma's for Thanksgiving, and I certainly wouldn't want to make her get sick. When should I get the vaccine if I know I have an event or something like that happening?
So I would suggest at least about 2 weeks, before, at least 2 weeks before, because you want to give your body time to build that immunity. And also in case if you were infected, there's an incubation period, so, you just have to be cautious. So at least 2 weeks.
So as we think about the holidays and moving into the holidays, do you have any recommendations or anything you would tell folks about if you're planning on going to a large gathering, especially if grandma's going to be there? What would you recommend?
Definitely just be cautious. I mean, obviously if you're sick, don't go. because it's not worth it. So don't go if you're sick. But if you go, then you don't have to be kissing and hugging. So just stay distant. Same thing for babies, especially during RSV season. It's like what we like to call hands off. So if you see a baby that's super cute out in the store, we don't need to be touching it. Don't touch its hands or feet or head. Stay away from the babies.
And when babies are exposed or get RSV, why is it so much worse for them?
Because
what happens?
Because they're still developing, and they haven't developed immunity like we have as adults, so they're very vulnerable.
So as we're kind of rolling into this, what do you think this year's going to look like? We know the last couple years have been kind of mild to moderate illness. What do you think that we're going to see this year?
Could be the same. However, based off of flu activity from the southern hemisphere, it's looking like flu season could be pretty severe in the U.S. this year. Flu season for the U.S. starts September, October, typically peaks around December, January, February, and extends into May. So again, our prediction is based off of what's happened in the southern hemisphere, and they've had a lot of activity, so that's why the prediction is that it could be severe here.
Okay. So if we protect ourselves now, kind of in that September, October, early November season, that should cover us with vaccine through that predicted season. Is that what you're saying?
It should. If you've got vaccinated earlier, some pharmacies may put their vaccine out like July, August, may not have coverage the whole way through.
Well, thank you for coming to talk with me a little
You're
bit
welcome.
about respiratory season.
Thanks for having me.
And I think that together, we can keep our community safe and healthy. So
Absolutely.
Thank you for joining us for Just for the Health of It. Until next time, stay safe and healthy.